Welcome to Functional Medicine Charlotte. I'm Dr. John Bartemus, and in this video I want to answer your question: what is functional medicine? And I also want to use an example to help you understand how a functional medicine approach is different from the conventional medical approach that you've experienced up to this point. And when you understand that, you'll understand how we can make a difference for you when all the conventional medical doctors that you've seen to this point haven't been able to. So let's dive into that. What is functional medicine? Functional medicine is a huge paradigm difference from conventional medicine. The goal of conventional medicine is to diagnose you, right? They take you through an exam, they might do some labs, typically they're inadequate, but they might do some labs, they might do some diagnostics, and if your labs are normal and you have nothing on your X-ray or CT or MRI or ultrasound, you're normal, and they're going to send you on your way. And if you keep pushing and you say, but doctor, I don't feel good, even though the testing is normal, they've exhausted what they do. They've taken you through their algorithm and found nothing. So at that point, they throw up their hands, they say, we don't know, or they offer you an antidepressant. So it is very diagnosis based. Also, say they take you through the process and you get a diagnosis. Well, based on the diagnosis you get a treatment. The treatment is dictated by the diagnostic algorithm. So if you're given a diagnosis for a certain disease, say hypothyroidism, then they're going to give you Synthroid or levothyroxine, T4 hormone replacement. Every single patient that's diagnosed with that is going to get that, regardless of the fact that every patient with hypothyroidism does not have the same cause to their hypothyroidism. Functional medicine is different in that exact point. We look at each person as an individualized and specific puzzle. Okay, so if you have a hypothyroidism diagnosis, you don't get the same treatment from functional medicine. If we have 10 different people in line, all with a hypothyroidism diagnosis from conventional medicine, we realize that those are 10 unique individuals, and all 10 of those unique individuals have different combinations of lifestyle factors and genetics and stressors that combine to make up their physiologic puzzle, which includes hypothyroidism. So these 10 people are each going to need a different treatment plan to address their 10 different puzzles, which all of them have one piece of their puzzle that includes hypothyroidism. Make sense? And so functional medicine focuses more on root cause. What is the cause of the hypothyroidism? Versus conventional medicine is symptom suppression. Okay, you have these symptoms of hypothyroidism, so let's suppress them with a drug. Okay, in the conventional medical model, you may have less symptoms on a drug, but you're never addressing the cause. So while you're putting duct tape over that check engine light and continuing to drive that car, eventually that car is going to break down because you never addressed the real problem. Conventional medicine realizes the check engine light is on, wants to open up the hood and look underneath and run diagnostics to understand where the actual problem is and correct it so you can drive that car forever. Okay? So let's continue with our thyroid example to help you understand this difference. A key part of a functional medicine assessment is the labs that we run, and even more key than the labs that we run is how we interpret those labs. So let's dive into that. You've all probably had labs run on you if you're watching this video, and you might realize that every lab run on you has your result and then has a normal reference range that your result is compared to. Now, that normal reference range would be drawn like this. Okay, so you have a low end and you have a high end. And if we stick with our thyroid example, in conventional medicine, their thyroid panel is a TSH, okay, thyroid stimulating hormone. And pretty much anywhere you go in the United States, if you're using a major lab like LabCorp or Quest, the normal range is going to be about 0.45 as the low end cutoff and 4.5 for the high-end cutoff. Now there will be some variance depending on where in the country you live, and the reason for that is that the normal range is based on the average of everyone tested over the past year in that area, okay? So here's normal range. So say you have brain fog and you have cold hands and feet, and you go Google that, and Google says that those are symptoms of low thyroid. So you go to your doctor and you say, "Doc, I'm having these symptoms, I think it's thyroid, will you test me?" They'll run a TSH, and maybe your result comes back here. And they say, "Jane, you're normal, follow up." Okay, so a month later, you still have brain fog and cold hands and feet, but now you're constipated. You go back, they run it again. "Jane, you're normal, follow up." A month later, cold hands, cold feet, brain fog, constipation, and now you're losing clumps of hair. You go back. They retest you. "Jane, you're normal," and you're frustrated because you're feeling bad and you're worsening each month. So you say, "Doc, I'm not normal." And they say, "But you are." And you're kind of annoying, so here's an antidepressant, okay? Follow up. You follow up, and then the 4th month, you're there, outside that high range. "Oh my gosh, Jane, you are lab high TSH with all these symptoms. That is diagnostic of hypothyroidism. You have hypothyroidism. You need to be on Synthroid. Here you go." And so you might think, "But doc, I've been coming to you for 4 months and I'm no, mathematician, but if we follow my trends, they've been increasing every time I come. Why are we waiting till right now to do something?" Okay? The reason is because in conventional medicine, you have to fit diagnostic criteria, and you don't fit diagnostic criteria until you're lab high or lab low. Anywhere else, you're normal, okay? Even though your quality of life may be tanking. Well, functional medicine says that's not normal, okay? And again, if the normal range is based on the average of everyone tested, well, who typically gets labs? Healthy people or sick people? Sick people, right? So they're telling you you're normal based on the average sick person in the United States. Functional medicine said that's not normal. Let's study healthy people. And so we zeroed in an optimal range. And so we have a functionally low cutoff and a functionally high cutoff. So we want to still honor conventional medicine's range so we can speak that language, but now anything below this is going to be functionally low and you're sick or suboptimal at that level. Anything above here is functionally high and you're sick or suboptimal there. You're not diagnosable, but we can catch you. You're trending. So if we catch you here, it's easier to turn that ship around and make a stop with my back to the 50-yard line than it is with my back to the goal line, right? We can still make a stop there, but the sooner we catch it, the better. So a functional medicine doctor would see this and say, time to make a change. And even though these two fall within optimal range, functional medicine may catch you there too, because functional medicine runs a complete thyroid panel, which is 8 markers, not 1, which conventional medicine runs. So if we ran the full 8 markers, we had 7 other data points to help us understand whether you're normal at these 2 points as well. And so with that information, we can understand your thyroid and understand what is driving the dysfunction and tweak that. That could be Hashimoto's, which is thyroid autoimmunity. That could be systemic inflammation from any other cause. That could be nutrient deficiencies, so you can't make thyroid hormone like iodine or tyrosine, or maybe nutrient deficiencies so you can't convert T4 to T3 like glutathione or vitamin A or selenium. So functional medicine's looking for the cause so that we can address it, and when we address it, you can be well again and go be consistent in implementing what got you well again so that you don't have to depend on me forever or any doctor forever. So if you're looking to find the root cause of your issue and not just band-aid over symptoms, functional medicine is for you, and we're going to find your cause with objective measures so that I'm accountable to it, you're accountable to it, we can take action, retest down the road, and show real change, objective change. So if you would like that, reach out to Functional Medicine Charlotte at 704-895-2240. Thank you.